What's up everybody, Dr. Rossi, StrengthsAndSneakers.com. So the last couple of videos I've been making have all been centering around the idea of lifestyle modification and lifestyle medicine as it applies to psychiatry. So it got me thinking a little bit the other day, and today after I completed a recent workout, I said, I should talk a little bit more about some of the benefits of exercise and some of the things I didn't mention in the first video. So one of the things that really comes to mind for me with exercise and how it influenced and impacted my own life and my own journey is that it builds resilience. And that's something a lot of people don't have these days, and I myself didn't have it. So prior to about the age of 21, I really didn't know where I was going in terms of my career. I wasn't even thinking about medicine or anything like that. And I was soft. I was what you would call mentally soft at that point. I wasn't resilient. I had no idea how to set a goal, take actionable steps towards the goal, and eventually reach that goal while tracking my progress, which is really, really important. And this comes up all the time in my work with therapy patients. A lot of people haven't even heard of the idea of goal setting and building resilience. So when I turned 21, I was going to actually be a police officer, and I was working towards that, and I knew I needed to get in shape. I needed to be able to do the push-ups and do the runs and do the pull-ups and all that other stuff. So I decided that that was going to be a focus of mine. And I really sat down and worked with my cousin, who was at the time working as a strength and conditioning coach, and we worked together to develop a program, and I really started to learn a little bit about what the weight room could really teach you. And one of the biggest takeaways I got from it was that I felt like I was far more resilient and mentally tough, right? When roadblocks used to come up in my life prior to that point, I would fold like a ton of cards, like a house of cards, right? If there was something that was in my way, if I felt like I couldn't do it, if I felt like it was really hard and difficult, I just quit. I just gave up on it. But the training really taught me how to program, number one, how to set those goals, how to come up with actionable steps to achieve those goals, and then how to do the work in between necessary to achieve the goal that I was looking and setting out to achieve. So that built a ton of resilience, and that really carried through for me, I think personally, when I decided to make the decision to go to medical school and to pursue medicine as a career, because as an international medical grad, as a Caribbean grad, there were many roadblocks along the way. There were many moments, that I think if I was the same person I was prior to that, I certainly would have quit. And I certainly would have given up on the journey. So I think exercise not only helps obviously from the physical benefits and also the mental and mood benefits that you get from it, but it really teaches you a lot about the basics of life and goal setting and achieving those goals, and again working through difficult situations, which is something I think a lot of my patients need and a lot of my patients would benefit from. So that's another reason why I like exercise, why I think you need to incorporate these type of things into your life if you're trying to have optimal mental health. With that said, I'm going to cut the video there. If you guys have other questions and comments about this, or you want to know more about why I think this matters and is important, drop them below, and please like and subscribe to the channel. We'll keep making more mental health videos.